Readings on the sensor are very different from the glucometer. What should I do? First of all, your glucometer is almost always more accurate than the sensor, as long as you use it in the right way. If there is always a large difference between the sensor and the glucometer, trust your glucometer. Then why sensor readings are sometimes different from glucometer? First of all, you should expect that the sensor is less accurate on the first day you start to use it. The sensor is still trying to understand your body. Wait till the next day, and you should be able to get more accurate numbers. Second, there is a lag between sensor readings and blood sugar. Or in other words, the number on the sensor is actually your blood sugar level at about 10 minutes ago. As a result of this, you should expect the number on the sensor is about 10% different from the glucometer. Don't be surprised that your sensor shows 220 and the glucometer shows 200. During the time when blood sugar changes rapidly, you should expect to see an even larger difference between the sensor and the glucometer, because blood sugar changed a lot more over that same time lag. Let's say if you're exercising or you just ate, don't be surprised to see that the sensor shows a much larger or smaller number than the glucometer. Third, the sensor reading could be different depending on which part of the body you insert the sensor. For example, if the sensor is too close to insulin injection site or insulin pump insertion site, or a scar or tattoo or any place where there is a lot of rubbing or movement, the sensor reading could be way off. Here close, I mean within 1 inch. You may want to insert the sensor at a different place and see if it becomes more accurate. Some sensors also allow you to calibrate them with glucometer numbers. After calibration, the sensor will become more accurate. Please follow the user's manual to see how to calibrate. Since sensors are inaccurate in so many situations, why should I still consider it? Because at least it tells you the trend of blood sugar. For example, you will know if blood sugar is higher in the morning or at night. This is a very important piece of information for changing diabetes medications. You can also figure out what types of food raise blood sugar more and avoid that kind of food. Some insulin pumps will give you more insulin when blood sugar is rising rapidly according to the sensor, and the pump will also suspend insulin if blood sugar is dropping rapidly according to the sensor. So sensor can tell insulin pump what to do next.